Hi, my name is Carlina Friedland, and today I'm going to be talking to you about influenza, primarily the influenza vaccine. The influenza disease is an important health topic worldwide. It shows signs and symptoms similar to other diseases such as fever, malaise, headache, muscle aches. There is no treatment for the influenza vaccine. The only treatment out there is to treat those signs and symptoms such as the fever, headache, muscle aches. The influenza can be a life-threatening disease, primarily in those with poor immune systems and vulnerable to diseases. It is a significant disease in the elderly as well as the young, and also those in chronic disease populations, since chronic disease populations tend to have weaker immune systems and a less ability to fight off infection. The influenza vaccine is the most cost-effective prevention. Again, there is no treatment, but getting the influenza vaccine can significantly reduce the probability of you getting influenza. And right now, it is the only way to prevent the influenza virus. So you might be asking, why is this important to me? Well, the main question around the influenza vaccine is whether to get the vaccine or not. And often when patients make that decision, it is based off of reasons not valid. A lot of times people hear myths regarding the vaccine, and they don't fully understand the importance of that vaccine. They might be told by friends or family who are also misinformed to just not get the vaccine. So the question is, have you received the vaccine? Do you receive the vaccine? If you've declined the vaccine, why have you made that decision? Do you have a valid reason, a very important contraindication to receiving the vaccine? A lot of times I find patients just plain don't want it. So this education is to give you some insight on the importance of receiving the vaccine and why it is not harmful. I do have a few patient goals or expected learner outcomes for the end of this presentation and education to assess your learning and to see if you've understood the teaching regarding the influenza vaccine. The first goal I have for you is to understand the myths regarding the influenza vaccine. Again, I think there's misunderstanding and myths that are brought up regarding the vaccine, which cause patients and individuals to refuse the vaccine. One of the main myths that I hear from patients is that the vaccine gives me the flu. This is not true. The vaccine is inactive. It does not contain a live flu virus, thus it will not give you the flu. You might not feel very good after, you might have a sore arm, but you do not have the flu virus because of the flu vaccine. Another myth to understand is egg allergies. People think if they have an egg allergy, they automatically cannot receive the vaccine, which is not the case. There is a vaccine out there that is safe for those with an egg allergy. They've taken the component out that causes that reaction similar to eggs. So you can get that virus. Now, a severe egg allergy, you still want to speak with your physician and an expert in that area. But just a mild case, even if you have hives from eggs, they have said that it is still safe to receive the flu vaccine, which I provided a chart later on in this presentation to show you regarding the egg allergy and influenza vaccine. Another goal is to understand the benefits of receiving the vaccine. The main benefit is that it keeps you safe. It helps prevent you from receiving the influenza virus. However, by receiving this vaccine, you are protecting those around you. There are patients and individuals out there in hospitals and the community, and if they get the flu, they might have a harder time fighting off the virus, such as those that are immunocompromised, those with chronic disease, the old and the young are more at risk of having a severe case of the flu. So for us who might get the flu and be able to fight it off quickly, if we don't receive the vaccine, we do get the flu, we can pass that on to others who cannot fight it off as easily. And I also want you to know signs and symptoms of influenza virus. They are common to other viruses and other diseases, but a lot of common signs and symptoms are fever, chills, headache, malaise, and runny nose. The main influenza pandemic that occurred from 1918 to 1919 killed over 50 million people on Earth, which at this time was about 2.8% of the world's population. This pandemic is commonly known as the Spanish flu. The Spanish flu killed more people in 1 year than the Black Death killed in an entire century. No other infection, war, famine killed this amount of people that the influenza killed in such a short period of time. At this time, scientists and medical experts did not know a cure or any prevention. There was no vaccine other than traditional remedies and techniques made by the tribal people. Another common outbreak of the influenza is what we know as the swine flu, which occurred in the 2009 to 2010 flu season. The swine flu came about because of an antigenic shift. An antigenic shift occurs when a viral antigen presents a new strain and the human immune system does not recognize this. So when the medical experts come up with the flu vaccine each year, they're predicting the strain of flu that's occurring. But if another strain comes about that year, that flu vaccine is ineffective, such as what did occur during the flu season of 2009 to 2010. So the vaccine is not 100% preventable, seeing how new strains can possibly come about. Future pandemics are almost certain because of the continuing mutation of the influenza virus, but this does not mean that the flu vaccine is ineffective or not good. It is still important to get it yearly because it will protect you against current strains that medical experts have predicted to be out there. Millions of people suffer from influenza each year. They estimate up to 5 million reported cases of influenza each year. With that, there are 250,000 to 500,000 deaths that occur worldwide because of influenza. Many patients know little about the vaccine, so getting the influenza vaccine can greatly help lower not only the reported incidence of influenza, but also the deaths that occur worldwide. The vaccine is the main action to protect yourself from the flu. By getting the flu vaccine, you're protecting yourself that season from the current strain of influenza. But not only are you protecting yourself, you're helping to protect possibly transmitting the disease to others, especially those that are immunocompromised and suffer worse from the disease. The influenza vaccine is the most cost-effective way to help prevent the influenza infection. Each year, researchers study the influenza virus to come up with the most effective vaccine for the season. Seasonal flu vaccines need updated annually to match the newly circulating virus, thus the importance to receive the flu vaccine each year. Some people think, oh, I had it last year, it should still be okay for this year. That is not true. It is very important that each flu season you receive the new vaccine because of, like mentioned earlier, the high mutation of this virus causes new strains each year, even multiple strains in 1 year. They recommend anybody greater than 6 months old to receive the flu vaccine. The flu season is from October to March, so it is important beginning in October and any time to March to receive that flu vaccine. But of course, the earlier the better to start prevention as soon as possible. There are a few key points that I want you to take away from this presentation and education around the flu vaccine. I want you to understand that the vaccine does not give you the flu. That myth is false. It is an inactive vaccine. It might give you those common side effects, but you will not actually receive the flu virus because of the flu shot. It is also important to remember to receive the vaccine yearly because there are new strains or even multiple strains in 1 year. It is important to receive the vaccine each flu season. And I also want you to understand that the vaccine is safe for almost anyone, even those with an egg allergy. I provided this chart here showing that even if you have a slight reaction to eggs, such as hives only, it still says to administer a vaccine made for those with egg allergies. There is a vaccine out there and that is safe for those that do have the egg allergy. Now, if you do have a reaction such as respiratory distress or cardiovascular changes because of the eggs, it says to refer to a physician with expertise in management of allergic conditions for further evaluation. But just a slight allergy to eggs, you're still okay to receive a vaccine. And other than that, there are very few contraindications to receiving the vaccine. That's why it is safe for almost everyone. So the first question I have for you is to tell me what a common myth is regarding the influenza vaccine. Is it A, the influenza vaccine is given annually since a new strain is found every year? B, the influenza vaccine benefits yourself and others around you? C, the influenza vaccine gives you a mild case of the flu a few days after administration? Or D, the influenza vaccine is given to healthy young individuals? Again, the answer is C. Myth regarding the flu vaccine is that the flu vaccine gives you the flu. Like I said again, it is an inactive vaccine. You will not receive the flu. You might not feel very great after the vaccine, but there's very common side effects of the vaccine. Like I said, the soreness at the injection site or just feeling a little lethargic. The second question I have are, what are signs and symptoms of the flu? Fever, runny nose, muscle aches, or all the above? That answer is all the above. Again, you will get those common side effects of a cold, flu, the runny nose, muscle aches, fever. You're going to feel tired. Again, those side effects and signs and symptoms are going to go away on their own without treatment, but getting that flu vaccine will significantly reduce your chance of getting the flu or a severe case of the flu. Question 3. What is an important benefit of receiving the flu vaccine? A. You will be immune to all strains of influenza. B. The vaccine helps prevent you from spreading the flu to others, especially those vulnerable, such as the young, old, and chronically diseased. C. You will only have to get the vaccine once. D. You do not have to worry about getting the influenza vaccine if you are healthy. So an important benefit is the fact the vaccine helps prevent you from spreading the flu to others, especially those vulnerable, like I said, the young, old, and chronically diseased, those with weaker immune systems. Now, it is not true that you only have to get the vaccine once. Again, it is yearly. It is also not true that you are immune to all strains of the flu vaccine. If a new strain does occur, like I mentioned with the antigenic shift, then there's a possibility that the vaccine will be less effective. Again, that is hard to predict if that's going to happen during the flu season. And this is the opportunity, if you guys have any questions, to go ahead and ask any questions about anything in the presentation or anything that you thought of or came up during the presentation.